And Dr. White, I think too, having the conversation now as we're talking about women's health and the things that we look for, I would be remiss if I didn't also bring in ovarian cancer to this conversation.
Absolutely. Ovarian cancer and other gynecologic cancers, like cancer of the uterus or cervix, many of these cancers can be prevented. For example, cervical cancer can be prevented with vaccination and screening and treatment of precancerous disease. Endometrial cancer and ovarian cancer, it's important to know the signs and symptoms so that women can look out for changes in their own bodies. I think the two most important thing that women can do to protect their health and reduce their risk of cancer is know their bodies, know what feels normal, know when things don't feel normal, and have a trusted clinician that they can follow up with, whether that's an OBGYN, a nurse practitioner, a primary care doctor, someone that they know, that they feel comfortable with, that they can talk about those changes, and that they'll feel listened to and heard and empowered to then seek additional testing as needed if new symptoms appear.
I think that's so. You want to have that safe space to be vulnerable and say, hey, I noticed this doesn't feel right, this doesn't seem right, this has changed. What does that mean? And trying to really understand and be an advocate for your own health.
Absolutely. Unfortunately, I think most women know more about breast cancer. There's more information out there, and they can see that mammograms should be part of their screening. But many women aren't aware of the symptoms of ovarian cancer or endometrial cancer. So, cancer of the uterus, the most common symptom is abnormal bleeding, particularly after menopause. And ovarian cancer, the symptoms are more vague. They can be abdominal bloating, pelvic pressure and pain, changes in appetite, or urinary or bowel habits. And these can be, things that kind of creep up or a little bit more slowly or insidiously. Unfortunately, when we talk to a lot of women diagnosed with cancer, many women had concerns and they either didn't know who to address it to, or the first person they spoke to said, it's menopause, it's nothing to worry about. And it's important that for women to be their own advocates. Really, I can't stress that enough, to know your body and to establish that relationship. Find a doctor that is part of your regular health care who listens to you and takes your concerns seriously.